Okay, you guys, so we are back with another Wellness Wisdom Talk today. So I'm Angela King, Indian River Acupuncture and Functional Medicine, and I have with me today Dr. Christine Nielson.
Hello, everyone.
And today we're going to talk about this question, this, enigmatic question of should you really take vitamins in a multivitamin supplement specifically, right? Because we see that a lot. And people, really sometimes come into our office and sometimes they have like a giant bag of supplements. And it's very often that they don't need all of those. And we don't like to see people waste their money or their resources on either A, buying a supplement that they don't need, right? Or B, buying an inferior quality product that they think is going to give them the benefit that they're looking for. But in reality, if it's an inferior quality product, which we'll get to at the end of the talk as to what you need to look for when you're buying your vitamins, then they're just wasting their money. And we really don't want to see that happen. So, Dr. Chris, what do you know about,
Well, I will tell you that in medical school, there was really only one required lecture on the whole of nutrition, basically, and vitamins, and most of it was biochemical and not necessarily pertinent to clinical use. So all of the things that I know now about vitamins and functional medicine, I've had to teach myself. So you may not be able to get this knowledge from your doctor, because I certainly didn't have a lot of background in it initially.
Right. And I think there's also, generally speaking, we've been in business, we've been doing this, I've been doing this for 14 years, right? And I've often heard, and we still hear this today, that, doctors will say, oh, don't waste your money, vitamins, you don't need a vitamin.
It gives you really expensive pee.
Yeah, exactly. Like you pee most of it out anyway, right? We hear that. We hear patients come in and say, well, my doctor said vitamins aren't useful or just don't take them. Well, I would say two things about that. Like Dr. Chris just said, medical doctors don't necessarily have the same training when it comes to health and wellness, but B, they're right about some of the garbage that's out there on the shelf, right? And so they're right about that. If you're buying some of the things that you just go to, Walmart or whatever, even CVS and buy, they're right, it really is garbage. So we have to be able to learn how to differentiate between a good quality supplement and what you may need, and leave the rest behind, right?
Is there a test that you could take to determine if you need vitamins?
Matter of fact, there is. Okay, so this test that we want to launch into talking about today is called it's by a company called SpectraCell, and I actually had this exact test done. I've had it done a couple times, but I had this exact test done when I started acupuncture school, because I was seeing one of my teachers or professors there was a naturopathic medical doctor from Bastyr University, and she worked in another clinic providing services while also being a teacher at the acupuncture college. So I went to see her as a patient, and she gave this test to me, and that was like back in 2003. So this test has been around for a long time, and it's very useful, and the methodology is really unique, and there's no other test like it that I know of on the market that's measuring this through white blood cell function. So there are some other tests that will measure through urine, okay? Or blood levels, right. I'm thinking of the NutriVal, right? But that's measuring metabolites in your urine and then estimating need for certain vitamins based on your metabolites and whether they're deficient or low. But this test is different. Okay, so here's the thing. If you have ever had like a vitamin D level checked, from your blood, or maybe your B12 level checked or something like that, that's when you just go and get a blood draw. And all that's measuring, though, it's a static measurement of the concentration level of that particular nutrient outside the cell, in the extracellular space, in the serum, right? So it's a static measurement. And what this test looks at is very different. It's called an intracellular micronutrient test. Micronutrients, by the way, let's back up for
Sure.
1 sec.
Okay.
Micronutrients basically are just your vitamins and minerals and amino acids. They're very small and molecules, and they're needed for so many essential functions in the body, right? So growth, development, immune function, metabolic, they're catalysts, right? So they're used in a lot of metabolic processes, things like that. So this is how we do this test, or how this test is done. You get your blood level drawn, and what they do is they spin out your lymphocytes and your granulocytes, which are part of your white blood cell system. And they actually challenge these to see how well they are performing in your cells. So it's a measure of intracellular function and utilization of these vitamins, how well they're being utilized how well you are utilizing these vitamins, right? So it's not just like a level that's like, do I have enough or do I not have enough, right? It's more about how well you're utilizing these particular vitamins. And you may find that you're taking it. We've had this happen a lot of times, right? Where you're actually taking the vitamin, but you still come up deficient in the test because you're not absorbing it or you're not utilizing it well. So that's why this test is very important, and why it's different than other tests out there. So this particular test measures 31 different vitamins, minerals, amino acids, antioxidants, and metabolites. So we're going to break those down for you in just a minute. But Dr. Chris is just going to mention for a moment, like, how even subtle deficiencies. So we were joking about like scurvy earlier.
Rickets or beriberi. This isn't a severe micronutrient deficiency or a vitamin deficiency, but there are even a subtle decrease can contribute to degeneration and disease processes, or worsen a chronic disease. Specifically, if your micronutrient levels are normal functioning, then that decreases your risk of developing something like cancer cells. If your antioxidant function is strong, then it helps to protect from DNA damage. Obviously, we know heart disease and cardiometabolic syndrome and diabetes are inflammatory conditions inside the vessels. So making sure if you have a condition, making sure you're taking the right micronutrients to modulate or prevent further inflammation. What was the other one? Oh, there was something about with autism or other neurologic things, vitamin D levels have been shown to help the neurologic system. B vitamins help the neurologic system. And then there are mood disorders, fatigue, sleep issues that, whether or not they're caused by the micronutrient deficiency, they can be worsened, or it makes the body makes it more difficult to treat. And then fertility issues. And then if you're on the wellness path and you feel like you're healthy and you want to just make your sports performance better, then make
golf,
sure you
tennis, right? I mean, all your leisure activities, you want that optimal performance.
Yeah, when you can get out there and work, you want to make sure you're working optimally. And then other medical conditions that affect your micronutrients are obviously things that affect your absorption: stomach surgery, celiac disease, other syndromes that affect the gut lining. Those are conditions that also lead to micronutrient deficiencies and make it harder to correct.
Yeah. So let's break down the vitamins and minerals that the test tests for. And what we want to do here is we're going to give you some, hopefully, interesting little factoid about each one of these that you may not have known before. Oh, something on Facebook.
Sound is going in and out. We'll talk to our producer.
Maybe, let's see, I don't know, do we need a microphone?
There's another Facebook Live.
Angela, yeah, if you can see it on, if the sound's going out on the Indian River Acupuncture and Functional Medicine Facebook page, you can hop over to Angela King, my public Facebook page, and you can hop on it there because we're live off that one too. Sorry guys. I know, it's like every single time there's one little glitch. I know, it's just like we have,
It's the joy of
yeah,
joy of Facebook.
the joy of like trying to do this. Okay, so maybe we're gonna just try to hook this up real quick and see if it works. Sorry, you guys. Can you hold it?
Yeah. I'll do the testing, 1, 2, 3. All right, let's see. It's on. Slide that. It's on the button, I think. Okay.
Okay.
Well,
So
keep
we're gonna
talking
keep
and-
that there and see if that helps with the volume on Facebook. We weren't using the mic earlier, but now we are. So like maybe that will help. If not, I would just say it's probably gonna have to be one of those days that maybe you just hop over to Angela King instead. Sorry. Here we go. Okay.
Talk about vitamins.
Talking about vitamins. So what we want to do is, like we said, we're going to give you a breakdown of what these vitamins do that are different maybe than something you already know about. So let's start with the B vitamins. So this is like B1, B2, B3, which is niacin, B6, B12, pantothenate, which B5. So all of these basically, most people associate their B vitamins with energy. So a lot of people, we give B12 injections here at the office. So a lot of people use their B vitamins and they think, okay, I need these for energy. And this is very true. This is definitely the case. But B vitamins do a lot more than just provide energy, right? So let's look at vitamin B1. So this is a vitamin that helps break down fats and protein and is important for digestion and your immune system. And if you have a low level of that, it can be a contributing factor for cognitive decline and Alzheimer's. Okay, so vitamin B2 also does kind of the same thing with breaking down this fats and proteins and carb metabolism. But it also, this is so interesting, if you have a low level of vitamin B2, it can be instrumental in development of cataracts. So I think that's important for people to know. We wouldn't associate necessarily vitamin B with cataracts, but that's the case with B2. B3 is niacin, and this helps the liver. It helps eliminate toxins. It's also important for stress hormones and sex hormones manufacturing in the body. But deficiency of vitamin B3 can actually exacerbate anxiety. So that's something, a mood disorder that's related to a deficiency of a micronutrient. B6, everybody's familiar with B6. A lot of people think of B6 with nerve function, and that's very true. But also, deficiencies in B6 can contribute to more of a depressed mood and also sleep issues. So the B vitamins can have an effect on your ability to get a restful night's sleep. And then B12, the common one we just mentioned, right? Very common, but it's also commonly deficient in a lot of people. And so other than energy, if you have a deficiency in B12, sometimes this leads to sensations of numbness and tingling in the hands and the feet, and also depression, dementia, poor memory. So the B vitamins are a very important group of vitamins. Biotin, we see a lot of women come in because they're taking excess biotin for their skin or their hair and their nail growth, right? So that's great, but biotin also, low levels of that can also trigger or be a contributing factor in depression. Folate, one of my favorite ones. So because I have had to really get on folate for myself, my levels were low. And this is something, if anyone out there knows about MTHFR, it's a genetic mutation that can cause low levels of folate in the body. And so I have that, and so I have to really be careful about my folate. So we're going to talk about that in a minute, the right form to take. But folate is essential also for, if you have low levels of folate, it can actually have contribute to high levels of homocysteine in the body. And homocysteine is a marker that's used to look at inflammation in the cardiovascular system. So again, most people might not think about folate and having a relationship to your cardiovascular system, but it most certainly does. So that's something to be aware of. And pantothenate also helps with stress tolerance and wound healing, interestingly. So we've had a couple of patients that have had some poor wound healing issues, and sometimes we need to look at that particular vitamin. Also, vitamin A, right? So vitamin A is a fat-soluble vitamin, and most people associate vitamin A with their eyes, and that is very true. That's necessary. But one of the interesting, because night blindness, if you have really low levels of vitamin A, it's possible that that's contributing to night blindness, okay? And then, okay, so, sorry, one more pause. It's saying sound is terrible. Okay, so Barbara, if you guys are having trouble with the sound, if you can go over and just search on Facebook, Angela King, just my name. I have a public profile and we're live from there too. So you should be able to just hop right on there and catch it. Sorry, you guys. Okay. So with the vitamin C or vitamin A, interestingly, if the deficiency is there too, that can actually inhibit your ability to absorb fat, and you end up with fat malabsorption. And that's not good because we need essential fats for the brain. We need essential fatty acids to help brain function, cognition, memory, immune function. So you definitely want to know if your vitamin A status is good. And then vitamin C. So everybody, like if I said associate one word with vitamin C, 90% of people would probably say their immune function, right? Their immune system, especially now. But the other things that vitamin C does a lot more than that in our body. And some of the things that can be a result of low vitamin C levels are muscle spasms, muscle cramping, tooth decay, and periodontal disease. So some people have struggles with that, with gum issues and gum disease. And so it could be exacerbated by low vitamin C levels. And vitamin D, we've also heard, a lot about vitamin D lately. And vitamin D has been, a really hot vitamin in the research for at least the last 10 years, right? At least.
Especially in memory and cognition.
Memory, cognition, immune function, all of those things. But a lot of people don't know that vitamin D is an essential vitamin for your thyroid function. So if you have hypothyroidism and your vitamin D levels are low, that's something that you should definitely consider supplementing with.
And fall risk. Vitamin D was the only vitamin that was shown to decrease risk of falls.
Yes. So vitamin K, also a fat-soluble vitamin that most people associate with blood clotting, right? But the other thing is with women who are still in their, still having their menstrual cycle, women with a vitamin K deficiency can often have menorrhagia, which is heavy bleeding. So that's something to pay attention to also, is if you happen to be a female who has heavy menstrual periods, doing a test like this can help you determine if your vitamin K is low.
All right, the next nutrient is vitamin E, which is an antioxidant, which is very protective against cardiovascular disease. And a lot of people take this when they notice that they're bruising easily to see if that will affect bruising. And also it's supposedly helps with hot flashes. Calcium is one that's very common. We all know about calcium for your bones and osteoporosis risk. There's not much more to that, but it's very helpful, or it's useful with the nerves, muscles, and the bones. Chromium is a mineral that helps with carbohydrate and blood sugar metabolism regulation. So that's something very important to have to decrease insulin resistance and prevent metabolic syndrome. Magnesium is in over 300 biochemical reactions and helps with muscle and nerve function and regulate heart rhythm. And that's another one that we use a lot every day. Selenium is another one that's very important with immune function, and we've been giving it to a lot of people during this time right now, but it's also an antioxidant that helps to repair inflammation. And zinc. Zinc is another one that's been common lately. It supports your immune system and also helps with wound healing. CoQ10. So CoQ10 is a powerful antioxidant. We talked about that a little bit already as far as cholesterol goes, and heart disease, congestive heart failure, and high blood pressure. It's very effective, and we'll talk about that later with medications that interfere with its absorption. Carnitine is a metabolite.
Oh, she's the
that helps with heart function.
speaker.
Oh, I'm talking not nearly as loud as my colleague here. Thanks, Deb. So carnitine is a metabolite that helps with energy and heart function, and if it's low, then it affects a lot of areas of the body, such as muscles, liver, energy, and cholesterol. Cholesterol goes up. And then we're going to talk about more antioxidants like N-acetylcysteine and glutathione. These are powerhouses for antioxidants. They have been shown to help heal the lungs, decrease inflammation, and decrease fatigue. And it just, in general, we are exposed to so many radicals, free radicals, in our food, in our lifestyle, in our substances that we expose ourselves to. So we need to have high levels of these to help protect our body and decrease DNA damage. Alpha-lipoic acid is another one that's an antioxidant, and it helps to help get the glutathione into our brains. And without it, we are at increased risk for neuropathy and cardiovascular disease. And finally, copper. It's a little less common mineral, but it's very, very involved in healing process and energy production. And without it, we're at risk for osteoporosis and anemia. So that's just, a lot of them are common, some of them are well known, but just, that's more than I learned in med school, basically, all of that.
Right. And there isn't, and again, there's not like, you can't just go to Quest and get all of these vitamins and minerals tested, right? It doesn't work that way. And you can't ever, when you go to a lab to get testing, you have to have a diagnosis to be able to have that test covered by your insurance. And so that doesn't work if you just go to the lab and you want to have like your entire vitamin, mineral, amino acid, and antioxidant status tested. But with a test like this, you can get that done. And another thing, we're going to talk about the actual, well, should I say it now? I might as well. Okay, I'm going to say it now. So with this particular test, the good news about this test is it is covered almost by Medicare completely. There's an $88 copay for our Medicare patients to do this test. So it's an amazing test that you can get done for almost, nothing compared to, I think it's about $400 out of pocket. I could be wrong, $390, something like that. But if you have insurance, like regular insurance, like Blue Cross Blue Shield, United, Healthcare, those things, there's a copay that you make with the test, and I want to say it's about $190. And Lisa, you might want to check me on that, because every time I say something for a lab, it's about wrong about 60% of the time. But I'm pretty sure about that one. And then you're just making that copay, and whether or not your insurance pays anything, you are not billed for anything beyond that. So this is something that most people can put on their as a target for them to be able to do, because it's going to save a lot of money in the long run by not taking things that you don't need and making sure that if you do need something, you are taking it because there's a demonstrated benefit or need for that particular vitamin, mineral, antioxidant, amino acid in your body. Okay, so why do we even have nutrient deficiencies in the first place? Like, I mean, everybody wants to just think if we just eat, food, that somehow we're going to have all the nutrients that we need. And this is just simply not true. So one of the big reasons for this is conventional farming methods. So, and this is just something that, has been an unfortunate sort of downstream effect of needing a way to feed the masses and to feed the masses affordably. And we have conventional farming. But the problem is, for a lot of the vegetables and the fruits and things like that, the soil is depleted, right? And the soil is where a lot of these minerals come from. Hey, Sandy, so I'm going to actually, one more pause, you guys, sorry. I'm actually going to turn off the live on Indian River Acupuncture because it looks like when somebody's joining there, the sound is still not working even with the mic. So if you can go over and hop over to Angela King, which is just my public Facebook page, you'll be able to hop on the live there and catch up. So just head over. I'm going to turn this off so we don't get any more issues there. Okay, so there we go. So conventional farming, right? It's really it's problematic in terms of, I mean, if you see a conventional farm tomato, like it's very pale, right? It's not, when you cut it open, it doesn't have that rich redness that you need for the lycopene and the other good nutrients to come from that tomato. It's often very pale inside. You know, we see things that have been, you know, overgrown because they're trying to make things bigger and better, and so you lose a lot of value, nutrition value, when we do things like that to the food. Conventional broccoli, even, it's a paler green. You see this all the time. So this is some of the reason that we're not getting the minerals or vitamins that we need through food.
And for a lot of our friends and family, we have to actually eat the broccoli in order to get the vitamins. Hint, hint, that's my dad.
Yes, that's true. Okay, so that's another reason that we could have nutrient deficiencies, right? It's just simply that our diet isn't diverse enough with all the different colors of the spectrum in order to get the nutrients that we need. So many people just, you know, they like eating their meat and potatoes, right? But if your plate looks yellow, white, or brown, okay, you have to know that there is not a lot of nutrient. You may be getting protein, okay, but you're not getting, and you may be getting fiber, like if it's some whole grain bread or something like that, but you're not getting these, you're not getting strong sources of these other nutrients. If you're, you know, like a perfect example would be like bacon, you know, eggs and white toast even, or wheat toast for breakfast. There's no color there at all. So without the diversity of the foods, you're simply just not going to get all the nutrients that you need. Another issue that affects nutrient levels, is Dr. Chris alluded to this earlier, is absorption. So your gut microbiome, we just did a talk on that last week. And so the state of your gut microbiome and whether or not there's inflammation there, whether or not you have enough elastase, you have good digestive enzymes, bile acids, all of that is going to affect your ability to absorb nutrients from the foods that you do eat. So if your gut isn't in good shape, you may have compromised, you know, nutrient, vitamin, mineral, nutrient status just for that reason alone. Also, obviously, things like lifestyle, so smoking and excessive alcohol consumption, all of these things, and actually even over-exercising, or people that maybe work outside and sweat a lot during the day. So even lifestyle issues like those, you know, sweating too much without repleting or building back those vitamins and minerals can cause compromised micronutrient status as well.
Yes, and you'd have to, you know, improve your antioxidants to help repair and repair and help your body get back to normal.
And one of the big things that a lot of you may not know, we want to just take a moment to break this down, is this. So there are many common prescription drugs that have a secondary effect of depleting specific micronutrients in the body. So Dr. Chris is going to talk about the most common. We're going to give you like the five or six most common prescription drugs and the nutrient that they deplete. So if you happen to be taking this medicine and you haven't had your levels tested, or you're not supplementing with that particular nutrient, and you need the medicine, right? So you just have to do some you know, cleanup, right? So right, some recon efforts basically to make sure that you're doing something to help yourself, because you have to stay on the medicine. So
okay,
let's start there.
So the class of drugs including antacids, like Pepcid and Prilosec, all the ones that decrease the acid in the stomach, not only does it affect your microbiome or your digestion, because you're not able to break stuff down and you're not able to fight off pathogens, it also affects your absorption of certain vitamins such as B12, folic acid, vitamin D, calcium, iron, and zinc. So important thing to know, again, if you need to be on them, then you need to be on them, but make sure that you're getting the proper vitamin supplementation to compensate for that. The next class of drugs is certain antibiotics that affect the gut, and these are more often the ones that cause GI symptoms or GI upset as a side effect, but tetracycline affects the absorption of calcium, magnesium, and iron, B6 and zinc, and then some of the mycins, like gentamicin and then the cephalosporins affect B vitamin absorption. So, and it's short term, I mean, most people aren't on the antibiotics long, but just knowing that that will affect the absorption of vitamins while you're on those. And then I alluded to this earlier, the cholesterol drugs that help lower cholesterol affect the absorption of CoQ10. So if you don't have CoQ10, that worsens or can exacerbate or contribute to various cardiovascular diseases, and it can affect your immune system.
Yeah, and also CoQ10 is important for good mitochondrial function as well. So you need mitochondria functioning optimally because those are the powerhouse of the cell, all the way back to like biology 101. The mitochondria make the ATP for the for the fuel for the body.
Yes. And then this I actually wasn't aware of, again, my medical school curriculum, right? So female hormones, taking female hormones or taking oral birth control pills can affect the absorption of a lot of B vitamins and minerals as well. And so when those minerals are depleted, it can contribute to depression, irritability, sleep disturbance, can increase your risk for cardiovascular problems and lower your immunity and affect your antioxidant protection. So being on estrogen or being on oral contraceptives can cause side effects of these things, but they can also, having depletion of micronutrients isn't helping.
Correct, yeah. So another big class of meds that people commonly take, whether over the counter or prescription, are anti-inflammatories, right? So we see these really in we're gonna look at three different classes. We've got your steroids, we've got your NSAIDs, which are your non-steroidal anti-inflammatory drugs, and aspirin. So many people reach for an Advil or an Aleve, or maybe they have prescription Mobic or something like that, right? And sometimes people have to be on low dose of steroids for autoimmune diseases or sometimes for uncontrolled asthma. There's different reasons why somebody might be on steroids for a long period of time. Steroids can really reduce the inflammation, but there is a cost, and one of the costs is micronutrient depletion. So steroids affect so many micronutrients, from calcium to vitamin D, magnesium, zinc, the B vitamins, like the whole gamut, selenium, chromium, folic acid, all of it. So if you find yourself having to be on long-term steroids, this would be something to be looking at. But the more common one is people are using NSAIDs. So this is like your Aleve, your Advil, ibuprofen, those sorts of things, Mobic, that sort of thing, right? So if you are a person who is reaching for those anti-inflammatories, know that the main nutrient that gets depleted is folic acid. Okay, so that's another reason to know, like, have I been on these long enough, or do I take enough of these where my folic acid is depleted? And we need folic acid for so many processes, methylation processes in the body. We need it for brain function, a whole host of things. So you really want to know if your folic acid levels are too low from taking too many NSAIDs or having to take NSAIDs a lot. And then aspirin, we see a lot of people who are doing the baby aspirin a day thing, and that's not bad, but it can definitely over time lead to deficiencies in vitamin C, and we know how critical that is right now for the immune system. Also calcium, folic acid, iron even, and vitamin B5. So the other class would be cardiovascular drugs. So these are meds that are used for hypertension or heart issues, and like your ACE inhibitors for blood pressure, or your beta blockers like metoprolol or atenolol, also in this category. And across the board, these types of drugs tend to affect the levels of zinc and CoQ10 the most. So we know that zinc is so necessary for immune function, and CoQ10 for cardiovascular, antioxidant, mitochondria, we just said that. So you really, if you're on these ACE inhibitors or beta blockers, it would be good to know if you need to up your zinc or CoQ10 to replete what's being, compromised by the drug. And last but not least, this is such a common drug for diabetes, metformin. And not only that, but we've seen its use now increase for cognitive decline and Alzheimer's a lot. There's some research in that area. Some people are taking it kind of preventively, but you know, there is a cost to taking metformin as well. And the most well-known documented problem with that is with B12. So metformin really has an effect on the B12 level, also on folic acid and CoQ10 as well, but big time on B12. So again, you don't want to take something, if you have to take it, you have to take it, but there's also a cost to taking it. So if you're informed about this and you do the testing, you can then balance this out by, you know, making up for what's missing essentially.
Yes. And in general, this is kind of advice that I would give back in the day when I was doing more family medicine or geriatrics. Polypharmacy is a real thing when you're taking way too many drugs or drugs that can potentially interact with each other. So in general, know your list of meds, know why you're taking each one, and be your own advocate. Is the risks outweighing the benefits? Do you still need to be taking it? And are you taking the minimum effective dose? So, you know, have you tried to go off it? Do you still need it, etc.? Just to be your own advocate, because yeah, prescription drugs are helpful, they're necessary, and they're beneficial, but you know, there can be drawbacks.
Right, and sometimes like when you make other changes in your lifestyle, so say you got put on a diabetes drug or a hypertensive drug, but you make changes in your lifestyle that affect those diseases, like maybe you lose weight, and maybe you start exercising, maybe you make dietary changes, and maybe you cut back on your alcohol, okay? Then you may not need that same dose that you were started on. Mm-hmm. So it's always good to talk to your doctor who's prescribing those so that you know, are on that minimum dose needed to manage or control that particular disease, right?
Mm-hmm. And particularly with something like pain medicine or sleep medicine, you know, make sure you are on the minimum dose that you need without all the side effects.
So what do you do with this? So with this particular test, all right, you're going to get your blood drawn and it's going to go off to the lab. And this is because of the extensive nature of the test. This one is one of the ones that takes us a little longer to get back. So I would say this one is really closer more to 3 weeks to get back. So what do we do when we have the results? So the results are given to us in like a bar graph form, and you'll see where normal values are, borderline status, and then deficiencies. And we'll see where your value fell with, you know, in that range. And then from that, you know, it's not necessarily that we're just going to give you a supplement for everything that you're missing. Our job is to look at your overall pattern of symptoms, the illness or disease that you might be suffering from. Or if you just did this as a wellness panel, like you don't really have anything major going on, but you did this as a wellness panel. So sometimes it's possible to replete these vitamin and mineral levels through food.
Especially if it's a class of food that you didn't eat before. Or you didn't realize, oh, walnuts are a great source of that.
Or Brazil nuts for selenium, or I could eat more kale and leafy greens, you know, for folate, that sort of thing.
Yeah,
so
that's
and
our number one.
That's our number one. We'd like to get it from food sources if possible, and depending on where your value is. So if maybe you're borderline status and you're overall healthy, we may say, okay, listen, we're gonna give you a list of foods and we really want you to incorporate these, and let's retest this in 4 to 6 months and see how you're doing. But if you have cardiovascular disease, diabetes, or you know, you're worried about dementia, things like that, and you have like really low B12 levels or things like that, then we know we're going to need to replete that with a supplement. And that's where we would take that into consideration and give you the proper dosing that you would need to bring those levels up. And that gets into our final, you know, what we want to tell you about is that this is where it gets really important in choosing your supplement, okay? Because a couple of things. Therapeutic dosing. Most things that you can buy over the counter, say like at your health food store or GNC or even like, you know, CVS or Walmart or something like that, a lot of the times the nutrients are given in sort of, I would almost call them wellness doses. They're not given in therapeutic doses because these are just sort of available to the masses and people grab one off the shelf without even reading the label or knowing what they're taking. But if you're going to try to replete something or bring it up to the level that it needs to be for optimal function, you're going to need to take a higher dose of that, and it would be best to have someone supervising you that knows how to do that for you, to help you with that. The other thing is, often we see this is like one of my biggest pet peeves, and this is where I said earlier that the doctors, when they say don't waste your money on, you might hear that from your doctor, don't waste your money on supplements or vitamins, you don't need them. But this is where they're right about some of these vitamins that are just like garbage out there. So I did a talk for our Chinese New Year event this year, and I found a label off of a particular supplement, and I'm gonna name it. It was Nature's Way. Okay, so you guys have maybe seen this you're in the store, right? And it was a CalMag supplement, so calcium and magnesium. All right. Well, so I read the label and it's awful. So first of all, you have to know the form of the nutrient that is best bioavailable for your system. Okay, so if you go read your label of your multivitamin, and if you have anything that says calcium carbonate, magnesium oxide, the folic acid, you might as well throw it in the garbage, okay? Because these are not bioavailable forms of these nutrients, but they're extremely cheap, okay? And that's why people kind of gravitate to these. So let's look at this. Calcium carbonate, this is limestone. That's what limestone is. So try dissolving some limestone in water, and your body is, 75 upwards of that % water. It's not bioavailable. So people are taking these, it's hard calcium, it doesn't break down well, it can irritate the lining. It's crystals, yeah, it can irritate the lining of the arteries, it's just not a good idea. Mag oxide, you can look this up, it's like 14% bioavailable, I think. So this again is not a good form to get your magnesium. So not only did the label on this have these, it's claiming to be a CalMag, but it's got these two terrible forms of the nutrient itself, right? It says on the other ingredients, soybean oil. I do not want soybean oil in my calcium and magnesium supplements. First of all, soybean oil is genetically modified because it certainly didn't say it was organic soybean oil. It's very highly processed and refined, and it's just not, it's inflammatory, actually. It's a pro-inflammatory oil that should not be in your vitamin. And it also had on the label, it said this, we actually put it up on the screen, it said gluten-free, okay, no color added and whatever else. And so then we look on the label and I highlight, it says right there on the label, color added. Right. What? This is junk.
On the same label.
So, and that's the thing, you can't just put a green leaf on the label and put the word natural or nature, in it and make it good. It's just not true. There's so many of those out there. You guys have seen them on the shelf that start like that. Nature's made, nature's way. They're junk, right? So really read your label and understand the form of the vitamin that you need. That also happens very commonly with CoQ10. So that Dr. Chris has talked about that a lot. CoQ10, a lot of people will buy ubiquinone that ends in N-O-N-E, right? That's a reduced form of ubiquinol, and it's less expensive than ubiquinol, but it is not very bioavailable. So again, you might be saving money buying ubiquinone, but you're not getting the bioavailability of the nutrient, the antioxidant that you really need, which is ubiquinol. So this is very important. And another one I'll mention briefly, I see this a lot. People have a B vitamin or a B complex or something. And for the B12, it's cyanocobalamin. And for the folate, it's folic acid. So these two are not the best forms of B vitamins. You need methylcobalamin, that's the B12 injections that we give, because it's already been methylated. This gets into methylation, which is way beyond this talk, but it's there's a methyl donor already attached to the vitamin so that it goes right into the methylation cycle and it's immediately bioavailable to your body. It doesn't have to be converted into anything. When you take folic acid, that is a man-made I don't know if people know that. Folic acid is synthetic. That's not natural. What's natural is folate, but folic acid is real cheap. And so they use it in bread and enriching products, but your body has to convert folic acid into methylated folate to be utilized. And so we only use supplements that have methylated folate in them because that process has already been done for you. Okay, so again, this is what you need to understand when you're buying these things off the shelf, and sometimes it's just, you're not getting your money's worth. That's what I want to say. So,
and I want to make one point about the whole food vitamins.
Oh, good point.
I mean, obviously you want to get the vitamins from the food, and then they sell whole food vitamins, which is kind of a good idea to kind of pack a bunch of different foods or the benefits of all the foods into a little pill. But most people will develop a sensitivity over time to something that they're taking every day. And that's true whether it's a food or a substance or whether it's a vitamin. So something that has a lot of different components all kind of mashed together, you may either already have a sensitivity to one of those foods or can develop it a little bit more easily.
Yeah. Those are like the vitamins where you see like the whole field vitamin, and you'll read it, it'll say like proprietary blend of, you know, kale, spinach, pomegranate, blueberries, superfoods, broccoli, you name it, right? But like Dr. Chris was saying, Chelsea and I did our talk on food sensitivities. And you know, from that talk, you guys learned that if you're eating a food that you're sensitive to, it causes an inflammatory reaction, low-grade inflammatory reaction in your body. So you definitely don't want that with your supplements. Right? Yeah. And yes, so somebody is agreeing with us. Cindy, you know that's true. So that's so important. Oh, I want to say one more thing about proprietary blends real quick. And then we're almost done. Proprietary blends, you'll see that a lot where it'll just say like, this one capsule contains 1,850 milligrams of the following ingredients, right? And it'll, in CoQ10, you know, vitamin A, vitamin C, it's all this, you have no idea what the breakdown is, okay? So maybe that's okay for wellness if it's a good quality. Maybe that's okay for wellness, but that's not okay if you have these deficiencies that you need to bring up, because with those, we need to make sure that you're taking the levels that you need, and we need to know exactly how much you're taking that's going to be effective in bringing the level up to where it needs to be. So last but not least, when I did this talk, or when I did a portion of this for Chinese New Year, I found a really interesting chart which gave the owners of a lot of these vitamin companies that you see on the shelf at your supermarket or GNC or things like that. So a lot of people don't know this, but so let me just give you an example. Who owns your vitamin and mineral company is important, because it's like, what is their real intention? You know, is it really health and wellness, or is it profits, right? And when it's profits, they're gonna do things cheaply and inexpensively, and call it natural and sell it to the masses. So we think that's just egregious at best, right? So for example, maybe some of you have seen Renew Life, okay? Well, they do some probiotics and things like that. Did you know that they're owned by Clorox? Clorox, yeah. I just can't remember the last time I thought that Clorox was into health and wellness. So also Emergency, that lovely little, you know, fizzy orange drink that everybody wants to drink for their immune system, and Centrum. Centrum is just like one of the worst multivitamins out there. The ingredients are terrible. But it's owned by Pfizer. So Pfizer is a pharmaceutical company. And why do you think a pharmaceutical company would be interested in a vitamin, right? Because they're interested in profits, and that's what I have to say about that. But so many of these other ones, you can look this up online. Even what used to be like one of my favorite over-the-counter brands, Garden of Life. I really did like them. They did a lot of raw stuff, a lot of whole food stuff, but they sold out to Nestle. So Nestle, the chocolate company, yeah. I'm having trouble stringing that one together. Nestle, the chocolate company, owning Garden of Life, like, okay, they're making water too now because they want to be in the health and wellness business. I don't know. All I'm saying is that you can see this for all kinds of these companies that's out there. There's a wonderful chart. Maybe we'll try to put that in the comments so you guys can see it. But I would just say that, when you're working with someone like us, we spend countless hours researching and vetting the companies that we use to make sure that these nutrients are what people need. And we are always also being conscious of your resources. We spend countless hours, looking at the number of milligrams per capsule and the cost to the patient and how many capsules are in the bottle. And we honestly, you can ask my staff, I drive them crazy with asking them to do this, because we want to make sure that our patients are getting the best, bang for their buck with a high quality supplement that they can trust, that they know that that nutrient is the best bioavailable form at the level and dosage that they need to help their body. So basically that's it. So that's what we have to say about micronutrients, vitamins, minerals, amino acids, antioxidants, and all of the ways that they can impact your health and your wellness. And so if anyone is interested in doing a micronutrient test, just call the office and we can arrange that for you. Again, Medicare covers all but $88 of it, and insurance just has a copay that you make. And that's all we have to say for today. Are there if there's any questions, but I don't see any questions now. Let's see. I don't see any questions. If anyone has any questions, feel free to contact the office.
Thanks for staying with us on this Saturday morning.
All right, goodbye.